Hello everyone, welcome back once again. Welcome to Grafam Academy. If it is your first time, kindly share, subscribe, and like and comment content in this channel. Today we are going to look at self-medication, and we need to really be attentive because self-medication has caused a lot of resistance. So we need to know what it is, what are the effects that come with it, and we need to appreciate a number of things under it. So let's look at more about it, about self-medication, and see what we need to learn today. So self-medication, we need to define it. So we see that the use of drugs to treat self-diagnosed disorders or symptoms, or the intermittent or continued use of prescribed drugs for chronic or recurrent disease or symptoms. What does this mean? Like if you are having headache and then you walk to the pharmacy or a drug shop and then you buy painkillers without telling your health practitioner you find in the drug shop how you're feeling, all the symptoms that are surfacing, and then you end up just getting a painkiller and then you swallow the medicine. So that's like you are self-medicating yourself. Or some of us Google our symptoms. We go on internet and then we Google the symptoms, and then what internet tells us on what to swallow is what we go and buy in these respective health outlets. Even when these people try to ask us what we need the medication for, maybe we tell them we are buying it for somebody, or maybe we know what we want. Yeah, sometimes a client comes in and they say, I know. Okay, so you find that that act of diagnosing, like saying I think I have malaria, and then you go and buy malaria medicines even without testing, just because you feel the last time you got malaria and you went and tested, you got the same signs. So when you do such a thing is what we call self-medication. In other words, you are giving yourself the medications you feel are right for you, and the ones you feel, or maybe some people feel like I feel cough, I feel this, I feel, maybe I think this is typhoid. Okay, sometimes they say I think, so they end up googling the drugs for typhoid and then they go and buy those medications without investigation, without explaining their symptoms to the health practitioners. That is what we call self-medication. Or in case other people are having chronic illnesses, for example, maybe hypertension, that's high blood pressure. So you find that maybe your first visit in the health facility, they gave you specific medications. So instead of going back for review to the hospital, you keep buying what they gave you, and you find that somebody's using the same prescription for 2 years, and yet they are required to always do review so that they check the pressure levels and maybe advise them accordingly on what to do. So when such a scenario also takes place, that act is what we call self-medication. So is the selection or use of medicines by individuals to treat self-recognized illness or symptoms with or without medical attention. Okay, just like what I have been trying to describe, like giving examples. The most widely used self-medicated substances are over-the-counter medications used to treat common health issues at home, as well as dietary supplements. Also, most of us can abuse most of the dietary supplements, whereby maybe medications for malnourished children, even a person who is not malnourished is buying it just because maybe the taste and Yeah, a number of factors can come in. Okay, so these do not require a doctor's prescription to obtain, or in some countries are available in the supermarket. Some of these medications, sometimes in other countries, you find they are even available in supermarket, where you just pick it and then you go and they tell you the price. Like, they don't even give instructions for swallowing, they're just giving you the price. Okay, so the responsible medication requires that medicines used are of proven safety, quality, and efficacy. So there is always need for us to appreciate that before we get any medications, we need to know that they are safe, they're of good quality, and they are of good efficacy. And then medicines used are those indicated for conditions that are self-recognizable and for some chronic or recurrent conditions. So these are some of the medicines that people mostly self-medicate. However, we find that self-medication may has caused a number of effects, and one of it is resistance, like medicine resistance, antimicrobial resistance, because you are taking the same medications even when you're not, like when the symptoms are different. You are thinking since it worked for you the previous time, it is going to work for you this other time also. So self-medication is an element of self-care, whereby self-care is the process whereby a lay person can function effectively on his or her own behalf in health promotion and decision making, in disease prevention, detection, and treatment at levels of primary health resources in the healthcare system. So what are the effects or consequences of us self-medicating? So when we self-medicate, we are most likely to take expired medications. Taking of expired medications, why? Because, for example, if you're finding this medication in the supermarket, we even sometimes don't look at the expiry date. Not only the medications you may find in the supermarket, you may also find some medications, or not dietary supplements in the supermarket, and we even forget to check. Actually, most of us do not check for the expiry date of these dietary supplements that we find in these supermarkets or any other grocery stores, not necessarily supermarket. Okay, so we find that expiry date is the least thing we are always checking for, and yet it is very important, because when you take expired medication, it is dangerous and toxic and poisonous to your health, and it puts you at a risk of so many other predisposing, like many conditions that come up with the consuming these poisons that have expired. So expiry dates are there to ensure safety and potency of the medication. So in some medications, chemical reactions can occur as the medications expire, making them very dangerous for you to consume. We also have undiagnosed underlying conditions. You may be treating, I may be having headache, I go and buy medicines for headache, and yet headache is a sign of a disease that maybe it is still developing, or it is just a sign that there is something wrong in the body, and yet I end up only managing the sign. So you find that I may keep having the same thing coming up because I am not treating the cause, I am just managing the sign. So treating ongoing symptoms without seeing a doctor could mean letting an underlying condition undiagnosed. Persistent rash and fever could be associated with underlying conditions that require proper diagnosis. However, we end up just purchasing maybe creams to treat the rash and manage the fever. So we leave the cause of the disease untouched, like unmanaged. Antibiotic misuse. We see that taking antibiotics when the nature of illness is not known can lead to bacteria developing resistance, which prevents these drugs from working effectively, and this can cause treatment failure. Okay, so we also see that there will be issues of mixing medications, and when you mix these medications, you're prone to drug interactions. And when drug interaction comes up, you find that some of the times we fail to know how to manage it, and we end up getting issues in the course of the treatment. Okay, so taking multiple medications together poses the risk of taking drugs that should not be taken together. For instance, taking Viagra and heart medications simultaneously. Somebody having issues with the heart, and then they are also taking Viagra. Remember, Viagra is over the counter medication, and this is a brand name for sildenafil. So you find that when you take them simultaneously, there is a massive, or it will cause massive drop in blood pressure and can trigger heart attack. Okay, so we have to be conscious when we are self-medicating ourselves. Inaccurate dosing, that is taking overdose, can be like threatening, and this can happen with self-medication. You're getting these medications, you're not sure what is my dosage, okay? So you end up you end up swallowing either overdose or underdose. So what's our role as pharmacy professionals in ensuring that we help these patients in the process of self-medicating themselves? We need to assist them in product selection. When they come into the facility, we have to ask them what exactly they are facing, and then we should be in position to give them a variety for them to choose from, or we should help them in choosing after finding out in case they are swallowing any other medications, so that we avoid drug interaction issues coming up. We also assess patients' risk factors. We need to assess contraindications and then warnings and precautions and comorbidities that they may be having or presenting. We need to counsel the patients regarding proper drug use. Okay, it is our role to encourage and talk to the patients, counsel them, tell them the advantages and disadvantages of the practice they are doing. For example, if a client comes in and then you ask them why they need whatever they are asking, and then they tell you they know, it's good for you to tell them what they may, or another additional information they need to know. The dosage, the drug interaction, so that in case they are swallowing any medications that will interact with whatever they are requesting for, they are in position to understand that I may not have to take this, but instead take options that will not interact with what I am already taking. Maintain patient drug profile that includes non-prescription as well as prescription drugs. We also need to monitor drug therapy of drug allergies, adverse drug reactions. Some of the patients come in as a result of drug allergies. So they want to manage the drug allergies. So you need to investigate and find out whatever this patient is treating. Is it an allergy? Is it adverse drug reaction? Is it drug-drug interaction? Or appropriate response to the therapy maybe they are already taking? Or signs and symptoms of drug overuse and dependency? Okay. Discourage the use of fraudulent and quack remedies. Okay. Also, when they come and ask you, you'll be knowing that the quality of whatever they're asking is not right. Okay. So you have to discourage them from it. Assess the potential of non-prescription drugs to mask the symptoms of more serious conditions. Okay, you also need to assess those non-prescription medications that they may come for, and also you need to educate them well. Prevent delays in seeking appropriate medical attention. So this brings us to the end of this lecture today on self-medication. I hope you got information on your role as a health professional in avoiding or reducing this incident of self-medication from happening, and the consequences of allowing these patients self-medicate themselves. not only patients, you as a healthcare professional may also be tempted to do self medications since you feel like you know how these things present. Okay, since you have been taken through the training and the rest, so sometimes we feel we know. Okay, so self medication is very dangerous. We need to be conscious when we are practicing it wherever we are. So thank you so much for listening. I wish you all the best and have a good time. Subscribe, like, and share to content in this channel for more exciting sessions like this.